Case 15 is on cystic fibrosis. First, I will address some common definitions and words that are associated with this case, and more specifically, cystic fibrosis in general. Cor pulmonale is an enlargement of the right ventricle of the heart caused by a lung disease that can eventually result in right ventricular failure. Atelectasis is an abnormal respiratory condition characterized by a collapse of an alveoli, which prevents the exchange of carbon dioxide and oxygen. Varices is dilated and often thin-walled veins. Meconium is the material that collects in the intestine of the fetus and forms the first stools of a newborn. Pneumothorax is a collection of air or gas in the pleural space that causes the lungs to collapse. Intussusception is displacement of one segment of the intestine into another segment, and it leads to abdominal pain and vomiting. Hematemesis is vomiting of red blood, suggestive of rapid upper gastrointestinal bleeding. Bronchiectasis is an abnormal condition of the bronchial tree of the lungs characterized by irreversible dilation and destruction of a bronchial wall. Hemoptysis is simply coughing up blood from the respiratory tract. Now to focus more on cystic fibrosis. It has not been found to favor one sex over the other. There are, however, a few clinical manifestations of this condition. Digital clubbing is one, and it can also be presented in many other diseases. It is characterized by the finger's angle at 180 plus degrees versus a normal angle of 160 degrees. It is more specifically a bulbous uniform swelling of the soft tissue of a digit with subsequent loss of the normal angle between the nail and the nail bed. It can manifest from an idiopathic form or a recessive trait. Gastrointestinal factors may be affected by this disease, although approximately 10% of CF patients do not experience gastrointestinal problems, and they are labeled pancreatic sufficient. This is possible because the individuals have a mild course of the respiratory disease. Thus, they reveal a lower mean sweat chloride concentration and have an improved survival rate over those that are insufficient. Low sodium is another possible manifestation. The panic level for hyponatremia is below 125 or above 155. It is dangerous because the brain cells don't adjust well to swelling. Therefore, mental status changes may be apparent, and they may result in loss of consciousness, coma, or even death. A barrel-shaped chest may develop in some patients with cystic fibrosis. This is a result of the lungs being chronically overinflated with air. This happens and the rib cage stays partially expanded at all times. This makes breathing less efficient and aggravates any existing shortness of breath. There are two main types of pulmonary classifications: restrictive and obstructive pulmonary disease, which can be hard to differentiate. Restrictive pulmonary disease is characterized by having difficulty or restriction from expanding the lungs with air. This can be due to different causes, including thickened lungs or chest wall, or by damage to the muscles or nerves. An example of restricted pulmonary disease is sarcoidosis and scoliosis. Obstructive pulmonary disease is when it is hard to exhale all of the air out of the lungs. This can be due to damage of the lungs or narrowing of the airways. Cystic fibrosis is classified as an obstructive lung disease. Nasal steroids may be used as therapy for CF patients. The common brand names for the nasal steroids, mometasone, Florinate, or fluticasone, are Nasonex and Flonase. In this case study specifically, we were presented with a 6-year-old male that had a history of CF with a diagnosis at 8 months old. The patient complained of fatigue, a productive cough with dark sputum, and a decreased appetite that resulted in a 2.5-pound weight loss over the past week. The patient's O2 saturation was 87% on arrival, and he was placed on oxygen therapy by nasal cannula. The patient's family history presents with the mother and father both being CF carriers and an uncle passing of CF at age 16. After further examination, the patient was noted to have multiple symptoms of double pneumonia. Some symptoms noted on the patient were the shortness of breath, the crackles and wheezing, with diminished lung sounds bilaterally. He had a positive sputum culture, and the chest X-ray revealed consolidation in the lower lobes bilaterally, all leading us to this diagnosis of double pneumonia. This concludes case study 15 on cystic fibrosis. Thank you.